My name is Dr. Howard Winston. I am the Medical Director for the Center for Health and Sports Medicine in Toronto. I am a sports medicine physician and family physician, but my main area or special focus practice is in sports medicine, sports injuries, and sports medical related type of problems. Well, when you design any kind of physiotherapy program, it's always easiest when it can be kept simple. And we use a lot of equipment in our facility, but it's just basic, simple equipment. A balloon is a simple piece of equipment, if you want to call it that. And it's a more sort of comfortable means of doing exercises to strengthen muscles without really overstraining muscles, which is easy to do when you use machines. And it's also very easy to learn as an individual, and it's something that's very portable. You can do it anywhere in the world. You don't need a fancy gym to do it in, although sometimes it makes it a little easier. But it's a gentle type of therapy program, and I find that it's comfortable and allows the patient to be more in tune with their body and how they're using muscles than the machine doing things for them. You know, that's a couple. I've sort of thrown a lot of different thoughts in there, but I'm thinking about things as I speak to you, and I think about what the advantages are of that type of system. My only concern had always been about the durability of the balloon and the fragility of the balloon, and making sure that things were stable so that it wouldn't break. It wouldn't cause a sort of a startling feeling for the patient, and I've been assured that's not an issue. So, you know, beyond that, I think it's really quite almost genius to develop a program with balloons. Some of these exercises can be done just in your office, you know, just sitting there in a chair in your office. So the practicality is great in regards to where you can do it, when you can do it. It's not something that you're going to create a great amount of heat and therefore workout and sweat that you have to shower afterwards. So it's a very comfortable type of program that you can do anywhere, really at any time, in any type of position. So it's really for anybody. Now, we're not talking about the serious athlete or a professional athlete, although they can do those exercises too. But we're talking about, you know, the patients that we see in our practice, the everyday person. Well, I think what's important is that people need to try and be active, you know, and that takes all different shapes and sizes. And we know that that's a sedentary lifestyle or an inactive life is certainly a significant risk factor, almost equivalent to smoking. So I think it's something that we need to encourage people to be, you know, more active with their body. And we also know that in order to try and live as long as you can, you also need the muscles to do it, you know. So as we get older, we know that we lose muscle mass every year past the age of 30. And this is one means of trying to maintain a certain level of muscle mass. As you know, getting out of a chair can be challenging for a 75 or 80-year-old, well, and even younger. But I'm saying that, you know, if the muscles aren't there, and I'll tell you another very important aspect of muscle strength and function is balance. You know, if you have muscle weakness, it will lead to issues of balance, and balance issues lead to falls. Falls lead to fractures. Fractures lead to hospitalization. So there's a whole sort of domino effect. So what we're looking at is trying to maintain a certain level of core strength and peripheral muscle strength to live a, you know, long and safe life. I think it's just a matter of being common sensible. I think people generally tend to exercise to extreme. I think everything in moderation, just like Mom recommended over the years, is probably the best recipe for success. And this is a great way to, I guess, follow that model.